No doubt about it, wearing a mask is tough enough, but the hot weather this weekend may make it harder.
Joining us now, Dr. Nicholas Testa, Chief Medical Officer with Dignity Health here in Southern California. Good morning. Happy Friday. Thanks for joining us, Dr. Testa. We're talking about the masks. It's going to be hot. We're already having this issue of people getting to wear them. Tell us, what are we going to face now?
Yeah, so, there is association between masks and heat-related illness. So it's going to be hot, and people are going to wear those masks because I'm telling them they have to wear the masks, okay? We can't say it's hot, so we'll take the mask off. What you need to do is be conscientious. So if you're someone who's at risk for a heat-related illness, so somebody with diabetes or obese or a young child, be really sensitive and watch out for the signs, right? So watch out. Are you getting dizzy? Are you getting overly fatigued? If so, take a break and rest. Get yourself a head covering. Drink a lot of water. What I don't want people to do is don't wet the mask, okay? Now, you may think it'll cool it down, but it won't help. It'll actually compromise the integrity of the mask, okay? So don't wet the mask, but you're all going to wear the mask this weekend.
Yeah, okay. Yes, sir. Thank you. With a steady rise of new COVID-19 cases over the last 4 months, what have we seen with rates of healthcare workers getting infected?
Yeah, well, California Department of Public Health just released some numbers for our state. We've seen 16,000 healthcare workers infected with COVID-19, which unto itself is a shocking number. I think what's more shocking is we've seen 100 deaths in healthcare workers in California. We've seen over 750 deaths nationally from COVID-19 in healthcare workers.
What about Dignity Health? Are you seeing anything in your workforce?
Constantly. It's a constant monitoring of staff going out either in quarantine, who we have been exposed, or those in full isolation because they're actually sick with COVID-19. And that's posing the biggest challenge for us right now because it's not about ICU beds, it's not about ventilators, it's about staffing. We need nurses primarily to keep those beds open so that they're available for the public when they get sick.
Okay, I have a question about people being concerned, or people who are not buying into the coronavirus being as bad as it is, honestly. And they say that, yes, there are more cases, but people aren't getting as sick. Can you speak to that?
So what we're seeing is that there's more cases. They're in a younger demographic, which means that the younger population, the 30s and the 40-year-olds who get sick, tend to not progress to hospitalization, oxygen dependency, and mortality. But that doesn't mean it's not impacting society. Our ICUs are filling up like we have never seen, right? So in Los Angeles, many of our hospitals' ICUs are now at capacity again, as they were 3 months ago. So our numbers are higher than they were 3 months ago. So yes, it's a younger patient population, but there's more of them. So, we gotta stay on top of this. And that's why I'm so adamant. We have to wear the mask, we have to wash our hands, and we have to stay at home.
And Dr. Testa, I would add anecdotally a very quick story. A friend of mine in Texas knows somebody personally who got COVID. His opinion of it changed remarkably watching what that person had to go through, and they were staying at home. So your opinion can change a lot when you know somebody personally who ends up with this disease.
100%. And we can do this. Yeah. We can do this. We've shown that we have. It's going to be that dimmer switch.
All right. Well, thank you very much for joining us again, Dr. Testa.
Okay. And coming up on